Hi guys, welcome to my YouTube channel Share and Learn. In this video, we are going to learn about adrenergic system. This system helps our body to cope up with emergency situations. First, let me give you a short preview about nervous system. So there is a system in our body which controls all the major activities in the body. That is known as nervous system. It is divided into two main parts, the central nervous system and the peripheral nervous system. The central nervous system comprises of the brain, which is the main processing center, and spinal cord, which is the main conduction center. Peripheral nervous system has two types of neurons. The sensory neurons, which carry sensory input from the sensory organs to the CNS, and the motor neurons, which carry information from the central nervous system to the effector organs. Further, they are divided into two parts, that is somatic nervous system and the autonomic nervous system. Somatic nervous system is voluntary in action, that is, it can be controlled upon our own will, whereas autonomic nervous system is auto-regulated and cannot be controlled by our will. It is divided into two parts, the parasympathetic division, that is the rest or digest system or the cholinergic system. Then is the sympathetic division, which is the fight or flight or adrenergic system. We are going to discuss this division of autonomic nervous system in detail. Adrenergic system, which is also known as sympathetic system, as its transmission is restricted to sympathetic division of FANS. It works in situations of fight or flight. Three natural catecholamines which are present in the body, those are noradrenaline or norepinephrine, adrenaline or epinephrine, and dopamine. Synthesis of catecholamines start with the precursor, that is phenylalanine. It is present in the liver and it is hydroxylated to produce L-tyrosine. Now, the tyrosine which was produced in the liver, it enters the blood circulation and through that it reaches the adrenergic neuron, and it is actively taken up into the neuronal cytoplasm by these transporters, where it is converted into L-dopa with the help of tyrosine hydroxylase. L-dopa is further converted into dopamine with the help of aromatic amino acid decarboxylase. Dopamine is the first catecholamine which is synthesized here. Now the dopamine which is produced in the cytoplasm of the neuron, it will be taken up by these transporters into the storage vesicle cytoplasm. Then this dopamine will be converted with the help of dopamine beta hydrogenases into noradrenaline. This noradrenaline is the second catecholamine which is produced and it cannot be stored on its own. Therefore, it is stored as a complex with ATP with three other noradrenaline molecules. That means it is stored in a ratio of 4:1 and it is adsorbed on the surface of chromogranin. In case of adrenal medulla, now this noradrenaline diffuses from the chromaffin granules into the cytoplasm, where it is methylated by phenylethylamine and methyltransferases to produce adrenaline, which is the third catecholamine. Now this adrenaline which is produced is stored in different set of chromaffin granules. So this was all about the synthesis of catecholamines. Now let us discuss about the release of these catecholamines into the synapse. Now what happens when there is a nerve impulse? When the nerve impulse propagates to the neuronal ending, there is calcium influx, as a result of which these chromaffin granules, they fuse with this neuronal membrane. As a result of exocytosis, all the vesicular contents such as noradrenaline, adrenaline, chromogranin, ATP, etc., they are released into the synaptic cleft. After they are released into the synaptic cleft, they act upon the adrenergic receptors, the alpha and the beta receptors, which are present on the postsynaptic effector organ membrane, and they produce pharmacological response. These receptors will be discussed in detail in the further slides. Now, after producing pharmacological response, this extra neurotransmitter which is present in the synapse, this has to be reuptaken in order to terminate its action. So there are three reuptake processes. The first is the axonal uptake, which is also known as uptake 1. Norepinephrine transporter or the NET, they are present on the neuronal surface, on the neuronal membrane, and they carry this noradrenaline, which is coupled with sodium, back into the neuronal cytoplasm. Their affinity for noradrenaline is greater than that of adrenaline. It is a major mechanism for terminating post-junctional action, as it reuptakes about 90% of the released noradrenaline. Next mechanism is the vesicular uptake. VMAT2 transporters, that is the vesicular monoamine transporter 2, they are present on the vesicle membrane. They carry catecholamines from cytoplasm into the storage vesicle by exchanging hydrogen ions. These are the same transporters which carry dopamine into the vesicular cytoplasm. The third reuptake is the extraneuronal uptake, which is also known as uptake 2. About 5% of the left noradrenaline is taken up by post-junctional tissue by amino transporters like ENT or OCT3. Some of the left catecholamine diffuses into the nearby capillaries, and through circulation it reaches metabolic organs such as liver, kidney, etc. Although most of the noradrenaline or the neurotransmitter has been reuptaken, even though if some is left, that is subjected to metabolism. Now let us discuss the metabolism of these catecholamines. There are two metabolic enzymes which are responsible for the degradation of these catecholamines, that is monoamine oxidase, also known as MAO, and catechol O-methyl transferase, which is also known as COMT. The catecholamine which is present in the neuronal area is first attacked by MAO and then attacked by COMT. Whereas the noradrenaline which enters the blood circulation will be first attacked by COMT and then attacked by MAO. But the end result in both the cases will be vanillyl mandelic acid. Now vanillyl mandelic acid along with other metabolites such as metanephrine, normetanephrine, MHPG or DHPG, they are conjugated with glucuronide and excreted into the urine. If their concentration in the urine is extraordinarily high, then it is used in the diagnosis of pheochromocytoma, which is the tumor of adrenal medulla. Adrenergic receptors are present on the post-junctional membrane of the effector organ. These are G protein coupled receptors. That means they increase or decrease the cyclic AMP or IP3 DAG production. On the basis of relative selectivity of agonists and antagonists, they are classified into alpha and beta. Alpha are further divided into alpha 1 and alpha 2 receptors, whereas beta are divided into three categories: beta 1, beta 2, and beta 3. Now let us differentiate between these five receptors on the basis of their location and the functions they perform. Talking about the alpha receptors, the alpha 1 adrenoreceptors are located on the post-junctional membrane of the effector organs, such as gastrointestinal tract, blood vessels, etc. Whereas alpha 2 adrenoreceptors are present on the prejunctional nerve ending, where they inhibit the transmitter release. They are also present in the brain, in the pancreas, in the blood vessels and platelets. Now, depending upon their location, let us see what functions do they perform. So the alpha 1 adrenoceptors on the smooth muscles, they contract these muscles, they constrict the blood vessels, they increase the secretions from the glands, the gut, the GIT is relaxed, glycogenolysis will increase in the liver, your eyes will get dilated, that is mydriasis, then your heart will start pumping fast, there is increased force of contraction. Whereas alpha 2 receptors, they have similar functions on the smooth muscles and the blood vessels, but on the nerve terminals, as they were present on the presynaptic membrane, they inhibit the neurotransmitter release. They are present on the platelets, where they perform platelet aggregation. The insulin secretion is decreased, as well as the sympathetic outflow is also decreased, and in the fat cells they inhibit lipolysis. Now let's see where beta receptors are located. The beta 1 receptors are present in heart and kidneys. Beta 2 receptors are present in lungs, uterus, liver and eyes, and beta 3 receptors are present in adipose tissue. How can you memorize these locations? So beta 1 receptors have their main function on the heart. You have one heart. And beta 2 receptors, they have main function on your lungs, and you have two lungs. So beta 1 are present on the heart and beta 2 are present on the lungs, and beta 3 receptors are present only on one location, that is your adipose tissue. The pharmacological responses produced by beta 1 receptors are increased heart rate and increased renin secretion on the heart and kidney respectively. Beta 2 receptors, which are present on the GIT, they will cause the relaxation of these smooth muscles, bronchodilation in the lungs, vasodilation and relaxation of the uterus, and there is glycogenolysis in liver. Beta 3 receptors, they will increase lipolysis. The adrenergic drugs are the adrenergic agonists that stimulate a response of adrenergic receptors. They are also called sympathomimetics, as they mimic the functions of adrenaline on the sympathetic system. They have three mechanisms of action: the direct, indirect, and mixed. Direct sympathomimetics such as adrenaline, noradrenaline, phenylephrine, salbutamol, etc. They directly go and act on the adrenergic receptors present on the postsynaptic membrane. Indirect sympathomimetics like tyramine, They enter the presynaptic membrane and enhance the release of neurotransmitter from these storage vesicles. The mixed action sympathomimetics like ephedrine, dopamine, etc., they can act both directly and indirectly. Let's discuss the pharmacological actions of adrenergic drugs. In the brain, most of the drugs they cannot cross the blood-brain barrier. But drugs like amphetamine, they do cross blood-brain barrier and exert stimulant effects on the CNS, beginning with mild alertness, reduction in fatigue, and then progress to anorexia, euphoria, insomnia. In large doses, there is marked anxiety or aggressiveness, and also may lead to seizures. In the eye, as you can see in the given picture, the radial muscles of the iris, they are getting contracted, as a result of which there is dilation of pupil, which is known as mydriasis. Also, there is reduction in the intraocular pressure. Therefore, these drugs like phenylephrine can also be used in case of open angle glaucoma. In lungs, there is a relaxation of the bronchial smooth muscles because of beta 2 innervation. The beta 2 agonists such as isoproterenol, albuterol, they are very effective and reliable drugs in case of bronchospasm. The heart is predominated by beta 1 receptors, where they increase the rate of contraction, which is known as inotropy. Also, the firing from SA node is enhanced, which is known as chronotropy. Then the conduction velocity of AV node is also increased, which is known as dromotropy. So in all, there is increased heart rate. GIT, though the effects are mild, but there is relaxation of the GIT smooth muscles. Therefore, there is decreased peristalsis and the constriction of sphincter. Obviously, in case of a flight situation, you do not want your body to perform digestion first. You want your body to supply more and more oxygen and glucose to your muscles. So the activity of digestion is reduced. In urinary bladder, the detrusor muscles they are relaxed and trigone and sphincter is constricted, because of which there is hindered maturation or urination. In uterus, it faces dual action. There is contraction because of alpha receptors and relaxation because of beta receptors. Depending on the agonist and its dose, effects differ on the blood vessels because they are innervated by both alpha and beta receptors. We observe vasoconstriction because of alpha receptors, especially on the skin, as the vascular smooth muscles contract. Also, there is increase in peripheral resistance and venous pressure, which lead to elevation in blood pressure. Because of beta receptors, especially beta 2 receptors, there is vasodilation of the blood vessels. Metabolism mainly occurs in the liver, muscles, and adipose tissue. There is increased glycogenolysis. That means more and more glucagon is converted into glucose and released into the bloodstream. Also, there is reduction in insulin, therefore, glucose will remain in the bloodstream. These two factors lead to hyperglycemia. Also, there is increased lipolysis in the adipose tissue. Now let us discuss the therapeutic uses of these sympathomimetic drugs. First are the pressor agents, which are also known as vasoactive sympathomimetics. because they constrict the blood vessels and elevate the blood pressure. Drugs like noradrenaline, epinephrine, phenylephrine, they are used under this class, and they are used in hypotension and also to control bleeding after hemorrhage. Second class of drugs is cardioselective sympathomimetics. As the name suggests, they are acting on the heart and they produce positive inotropic effect. Drugs like adrenaline, isoprenaline, dobutamine, which are coming under this class, are used to support the heart along with the pressor agents in case of cardiac failure or cardiac arrest. Third are the bronchodilators. Drugs like isoprenaline, salbutamol, terbutaline, they are used in the treatment of asthma and bronchitis because they are beta-2 selective agonists. They cause bronchial smooth muscle relaxation. Nasal decongestants. Example, phenylephrine, nefazolin, oxymetazoline. They are used topically in the nasal area, and they perform the constriction of the already dilated arterioles, and there is reduction of the nasal blood flow, therefore relieving the congestion in that area. The next class of drugs are the CNS stimulants. As I already told you, they are stimulants of the central nervous system, therefore they will produce increased alertness, there will be less fatigability, your concentration will be increased, and work capacity will be increased. These drugs are misused by athletes to increase their athletic performance, but this enhancement of performance will be temporary, which will be followed by deterioration. These drugs can also be used in case of attention deficit hyperkinetic disorder, which is mostly diagnosed in children. These are also used in case of epilepsy and Parkinsonism. Next class of drugs is the anoretics. Anoretics are the drugs which decrease appetite. They act on the central nervous system and they decrease hunger, leading to weight loss. Drugs like dexamphetamine, fenfluramine are used in this category. Uterine relaxants and vasodilators. Beta-2 selective agonists are used to delay premature labor, and the preferred drug is ritodrine. But at these concentrations, these drugs can also cause tachycardia, therefore these have to be used carefully. These drugs also have ophthalmic uses in case of open-angle glaucoma. Drugs like epinephrine, dipivefrin, they decrease the intraocular pressure, therefore they can be used in case of open-angle glaucoma. Also, drugs like epinephrine, nefazolin, phenylephrine, they can be used topically for conjunctival congestion as they constrict the blood vessels. Sympathomimetics also produce adverse effects on central nervous system such as restlessness, headache, palpitations, seizures, and anxiety. On the cardiovascular system, they can produce arrhythmias, ventricular tachycardia, vasoconstriction leading to hypertension, angina, etc. Some other side effects include dry mouth, nausea, sweating, anorexia, muscle cramps, etc. This was all about adrenergic system. Hope you have a better insight into this topic now. If you do so, like and share this video and subscribe to my channel. For queries, message me in the comment section. See you in the next video. Bye bye.